see. To those of you on the phone, we'll start in just another minute or so. Please remember you're all muted. Hit *6 to unmute when it's time to ask a question. Thanks. Hey, good morning, everyone. Thank you very much for joining us. Just wanted to highlight a few things for you, and then we'll be glad to answer questions. We are seeing some improvement in our numbers. As you know, for the past couple of weeks, we've had declines in our number of cases. Very thankfully, we've had declines in our number of hospitalizations as well. We're down to just over 1,000 inpatients in the state, which is not a great situation, but it's about two-thirds less than we were seeing a month or so ago. We have not really seen a change yet in our number of deaths. Unfortunately, deaths, as you know, are the last number we see to improve because we still have people in the hospital who just haven't been well enough to get out. We right now stand at 14,756 deaths that we have confirmed. We have many more that have been reported to us, so around 15,000 deaths total. I know you've heard the statistic that about 1 in 500 Americans have died from COVID-19 in the past year and a half. In Alabama, that number is about 1 in 330. 1 out of every 330 people in our state has died from COVID-19 since the pandemic began spring a year ago. We do have one good milestone to note. We actually surpassed the 2 million mark this week in terms of numbers of Alabamians who are fully vaccinated. More than 2 million Alabamians now, which is more than half of the eligible population, has been fully vaccinated. We're very happy about that number. That number still lags a lot of the country, however. We have a lot of room for improvement. As of today, we are ahead of about 8 states in terms of people who've gotten at least one shot, ahead of 3 states, I believe, in terms of people who are fully vaccinated. So we still have a lot of room to go, a lot of improvement. We're expecting in the next couple of weeks some pretty significant events. This coming week, we'll see the FDA Advisory Committee meet to talk about booster doses for J&J and also for Moderna. We think that they're going to be meeting this coming next week, this coming Thursday and Friday next week. And so we should know something by the end of the week next week on booster doses for those products. As you know, we are already doing booster doses for Pfizer, but have not had guidance so far on those other 2 products. In a couple of weeks, on October 26th, that same advisory group to FDA called the VRPAC is going to meet to talk about pediatric COVID vaccinations. They're going to talk about adding the age 5 years through 11 years old group. As you know, there's already approval for age 12 and up, so that would potentially approve or make eligible the 5 through 11 group as well. So we'll know more about that sometimes towards the end of the month. It's certainly very, very possible that we could have a vaccine available for all kids age 5 and up by early November. We think that's very likely, in fact. Just to remind you how the process works, after the FDA makes that decision to authorize a product or to fully approve a product, it then goes to CDC for their advisory group, the ACIP, to review that data, and the CDC to make a full recommendation before we begin endorsing that here in the state. So that process usually overall can be done in as little as about a week or so. So hopefully in the next 10 days or so, we'll know more about booster doses for Pfizer and Moderna. We still recognize that our children who are eligible, our adolescents and teenagers aged 12 through 17, are the least vaccinated group in the state. That's very unfortunate. We continue to see numbers of kids who are infected, and fortunately they tend to do well, but we certainly want to keep them from getting sick if possible. They certainly serve as sources for infection to other people as well, and we strongly encourage those parents who are thinking about getting their kids vaccinated, please talk to your child's pediatrician, please talk to your healthcare provider, and consider doing that. We do have the holidays again coming up. As you know, next month will be Thanksgiving, and that's really the time that we had our really significant outbreak began last year. If you go and get vaccinated in the next week or so, you will have time to be fully vaccinated and protected before the Thanksgiving holidays. And really next week is pretty much the time that you're going to need to do that if you're going to have the safest possible Thanksgiving. If you get a Moderna or Pfizer shot, you would need to get a second one 3 or 4 weeks later. You need a couple more weeks to realize full immunity from that. And so you really need 5 or 6 weeks from when you get your first shot in order to be fully vaccinated. Please consider doing that before the holidays. We know that when you have the holidays, lots of people travel from all over. You have people spending lots of time mostly indoors in many cases. You're in situations where mask wearing just isn't feasible. And so if you're unvaccinated and you're going to be in that environment, please make a decision to get vaccinated so that you don't put other people and yourself at risk as well. We have been providing third doses of Pfizer as booster doses, as you know, for a few weeks now. We have so far given, it looks like, about 84,000 third doses of either Pfizer or Moderna since we began doing that. The Pfizer, of course, is approved as a booster dose for certain groups. The Pfizer and Moderna together, both of them are approved as an additional dose in certain types of immune-compromised people. We don't really have a good way to break down how many of these 84,000 doses are people who are just getting a third shot because of immune system problems, and how many are getting true booster doses, although I think that most of them are likely to be booster doses. We still have a long way to go, given that we have 2 million people who are fully vaccinated. Now, of course, not all those people are eligible for booster doses. Remember, the booster doses are for people age 65 and up, people in nursing homes and similar living arrangements, and people with certain health problems. But it looks like right now we've had about a quarter of our population that's age 65 and up that has received a third shot, so around 25% of those people. Remember, about 80% of our people over age 65 have been vaccinated. Only about a quarter of that age group has gotten their third shot. Some of those, of course, may not yet be eligible. If they're not 6 months out from their second shot, then it's not time for them to get a booster dose yet. But we hope that those people who are still vulnerable will consider getting a third shot when it's time for them to do that. I wanted to point you to a study that HHS released this week. It got a lot of national attention, and I think you may have seen it, but it looked at the effectiveness of the vaccination program in seniors. The estimates from that study are that about 100,000 hospitalizations and 40,000 deaths have been prevented. Almost 40,000 deaths have been prevented by vaccination in that age 65 and up group. That's entirely consistent with everything that we have been saying all along. The very best way we know to end the pandemic and to keep yourself and others healthy is to get vaccinated. So please consider doing that. I want to add one additional thing about flu vaccine. Please remember that flu vaccine is now available. I got mine last week. The flu vaccine can be given with the COVID vaccine, or there's no need to separate them. You can take those two at any time with respect to each other. We fortunately had a really low incidence of flu this past year for a lot of different reasons, but we don't want flu to come back. And the same people who are susceptible to serious illness with COVID are also generally susceptible to severe influenza. So please consider getting the flu shot as soon as possible. It's widely available, and we hope you'll consider doing that very soon. The flu vaccine is for everyone 6 months of age and up. There's almost no reason not to take a flu shot. Even people that have allergic reactions to flu shots, in most cases, can still take flu shots. Talk to your physician about that. But please consider doing that if you haven't done that. If you're someone who's never gotten a flu shot, please do it this year at least. Please do it at least once. Help us to try to minimize the amount of influenza we have, along with the COVID epidemic that we still have going on. Just a couple of other items. We are learning more about the new Merck oral antiviral medication. It's Monopyravir, and it's a pill, an antiviral pill that's somewhat similar in action to the remdesivir drug that's given IV. It's a drug that's been around for a few years. It was developed for a different type of viruses, but that seems to have very good activity against COVID. This is a pill that would be taken by people in the outpatient setting to keep them from getting sick and to keep them from getting out of the hospital. It's the only other early treatment we have besides monoclonal antibodies, which are given by injections, as you know, for people who aren't yet sick enough to be in the hospital. We're trying to figure out how this drug is going to be distributed. It's also going to be a scarce resource. It's not clear if that program is going to be handed off to state health departments as well for us to distribute the same way that we've had to do with vaccines or with remdesivir or with monoclonals. We frankly hope it's not handed off to state health departments, but we're still waiting on more guidance on that. Let's see, just a couple of other items. We've had about 1,199 school-aged children with illnesses for the previous week, the week ending October 2nd. That's about a 56% increase over where we were last year. We know that several school systems are having fall breaks over the next 3 weeks, so we're not sure if there will be any COVID reporting on our dashboard from those school systems. So we're monitoring that. Just be aware that there will be some schools probably not reporting on that. I wanted to let you know that we have 3 National Guard teams who are working right now in Alabama hospitals. That's in Monroe County and Pike County, and in Demopolis. In Marengo County. They are assisting with hospitals. Additionally, we have 2 monoclonal teams that are given sub-Q injections that are operating now, one at the St. Vincent's Hospital in St. Clair County and one at Jackson Hospital as well. And I think that's all I want to cover right now. I've got a lot of other items we could certainly get into if you have questions about, but let's go to questions if you have those.
Dr. Harris,
yeah.
Recently some U.S. representatives in the House for Alabama wrote a letter saying, questioning Biden's kind of the way he's giving out the monoclonal antibody treatments. What is that situation looking like in the state right now?
Yeah, so, as you know, the HHS sort of changed the way monoclonals were distributed a few weeks ago, but until about 3 or 4 weeks ago, any provider who was giving those products would just order them directly, but because there was such a huge demand with the spike in numbers, especially in the Southeast, those drugs were acquired by the federal government and distributed through state health departments for us to figure out how to prioritize and where to send. So that has sort of meant that we had less overall than we were getting before, although it's a sort of a formula that applies to every state so that every state has the ability to get some. This past week, we were allotted 4,228 courses. That's probably half of what we were seeing 5 or 6 weeks ago. We had requests for about 10,000 patient courses, so we got about 42% of what we were requesting. We do have a lot more sites that are up and giving those, but the formula that's used to determine what you get is based on your case numbers and your hospital numbers. So fortunately, our case numbers and hospital numbers are going down, and that's resulted in us having less doses available.
Dr. Harris,
yeah.
We've seen a lot of large crowds at the football games throughout the state, packed capacity, 100,000. As weeks have gone by now, have you all noticed any kind of spikes in some of these places and counties as far as COVID, as far as a lot of people not wearing their masks?
I would say no, not directly. Clearly we've just come out of 2 months of really difficult numbers. those numbers, began spiking in late July and early August before, most of these types of things were going along. I think we've always, felt a little bit better about outdoor events, than indoor events anyway. But, when you have high levels of transmission going on in the community, it's really hard to put your finger on it and say, well, this is a result of a game or this is a result of, whatever event. So it's hard to say. So, yeah.
Dr. Harris, on the monoclonal antibodies, the fact that the state just got less than half of what they wanted, or does that mean a lot of patients are going without, and what kind of impact does that have?
Yeah, I haven't heard those stories as much in the past couple of weeks. The doses are ordered each week in advance by providers who are sort of, predicting what they're going to need. So I don't know necessarily that, that 50% that we didn't get were going to be assigned to a given patient, but clearly there's not enough to go around. I mean, there are a lot of people who, are probably eligible who aren't able to access it if there's just not any available in the state. We really heard a lot about that in the first and second week of September when the distribution changed and suddenly there were people who just couldn't order it at all for a week or two. I have not heard as much about that since then.
Dr. Harris,
Yeah.
Another question here. We mentioned the games. We mentioned a lot of people who may be vaccinated. A lot of folks, we know about the mask, still won't wear the mask, don't believe they should. A lot of the questions we've been asked with some of our viewers is, when will we get back to normal? Is it time? With these numbers coming down, can we start relaxing some of the masking guidelines, even though there's not a state mandate? What are your thoughts on that as far as addressing someone who is getting into COVID fatigue again?
Yeah, I mean, I think we're all full of COVID fatigue, and clearly we're not going to do this forever. We need some type of off-ramp. We've got to get back to some sense of normalcy. I would say that now's not the time. We still have more than 1,000 people in Alabama hospitals. Our deaths the last few days were 81 deaths yesterday, 63 before that, 70, 71. We're having double-digit deaths. I mean, several dozen deaths a day. They continue, and so I don't think this is the time to do that. It is just guidance over mask. There are plenty of people who feel perfectly free not to do that because I see them every time I get out of the house. There are school systems that feel perfectly free not to require masks. And so we're not requiring masks, but, my medical opinion as a physician is when there's a pandemic still going on, you ought to wear a mask. That seems like the very least you could do. I mentioned it to someone who asked earlier, if you're in a rainstorm with an umbrella, you don't go, hey, I'm not getting wet. I might as well put my umbrella away if it's still raining. I mean, that doesn't make any sense. And so we're wearing masks because they help prevent transmission of disease. There's still hundreds, in fact, more than 1,000 cases a day in our state every day for the past several days. And so now is not the time. Yeah.
What are the main factors in the hospitalizations going down so much?
I think it's because of the declining cases is the main thing. We were seeing in late July, early August, almost into September, 4,000 and 5,000 cases a day. And we've said this kind of since the very beginning. There's always going to be 10% or maybe a little less than that, 8 or 9% of all those case numbers we get today are going to be in the hospital in a week or 10 days from now. And so when you get down to 1,000 cases a day, you're at a third or a quarter of what we were seeing. You're just going to have less people being admitted to the hospital, and I think that's probably the biggest part of it. There's other reasons too. I think monoclonals keep people out of the hospital. So when you have cases and you're able to treat them early, that certainly does keep people out of the hospital. And we also have 2 million people fully vaccinated, and vaccination prevents or protects against serious illness and hospitalization. So even when you have cases that are being diagnosed, most of the time those vaccinated people are not going to end up in the hospital.
Why do you think the case numbers fell so much from 4,000 or 5,000 a day to 1,000 or so?
I would not be telling the truth if I told you I knew. I don't think we know the answer to that. I will tell you we've seen this with the Delta variant in other parts of the country and in other parts of the world. There seems to be a cycle of a couple of months in which it sort of burns through different areas. We saw it first in Arkansas and Missouri. We had, similar things happen in places like India and in the UK, which are actually really very different in terms of what their restrictions were and what their vaccination rates were. There's a lot of kind of social theory being written about how groups interact with each other and how, some groups just by nature may be people who are at high risk and other groups by nature may be people at lower risk. And so maybe it just takes a couple of months to reach all the high risk people at high risk for infection. But the truth is, I don't think we know. I think this is just an observation that we're making, and we don't have all the reasons to explain it.
Dr. Vargas, is it still just the Delta variant that is the majority of these cases, or are there other ones?
Yeah, it's almost all the Delta variant. We actually have a list of what we're seeing, but it's more than 90% Delta. In the past week, we let's see, we did a genomic sequencing on about 4,000 or so cases, and well over 3,000 of those cases were Delta variant, and then just a smattering of other ones. I think we're very fortunate that we haven't seen the emergence of a new variant for a while that we're really worried about. There have been some new variants that have popped up. We've had the Mu variant, but it doesn't seem to be worse than the Delta variant at all. There have been, we still occasionally get some of the earlier ones, Alpha or Delta or Gamma, but it's almost all Delta, and Delta is the one that's easiest to transmit, so it's not surprising that's the one we're still seeing. And that's true for the whole country. Yeah.
Dr. Harris, this is Brian Mossel with WHT.
Yeah, go ahead.
Sorry, maybe this isn't fair to ask you, but as we look at the case numbers going down and folks, getting ready for the holidays, are you worried about? I keep hearing about the possibility of variants. Is there any reason to feel confident that this holiday season will be different, given the number of vaccinations and the number of people who've acquired COVID already, or is it ridiculous to try and estimate that at this point?
Yeah, it's not ridiculous to try. That's what we try to give people the best advice we can. But I would just have to be honest and say we just don't know. Having 2 million people fully vaccinated, that matters a lot. That helps a lot. The fact that many people have already been infected will protect a lot of those people against reinfection, although, we don't know how long that immunity lasts. And, we're still learning about the immunity for vaccines, for that matter. So we don't always know how well people are protected, either because they've been vaccinated or because they've had prior immunity. We hope that our most vulnerable people are still taking precautions. If you're a senior or you're somebody with chronic health problems, you need to really think carefully, about what you're doing and who you're with and how long you're with them and what their vaccination status is and so on. It's still a really good idea to take those kind of simple precautions, even though we're all tired of it and we all want to get back to normal. So I would just say we're, maybe cautiously optimistic that the holidays will look different, but I just don't have I don't have a high confidence level in saying that.
Just one quick follow to that. Thank you. When we think about the not vaccinated individual and the schedule you laid out earlier, that next week's kind of the window to get it done before Thanksgiving, does that apply to the booster people as well, or is it a different math at that point?
I don't think we know. We haven't had the booster doses around long enough to say that for sure. The information that we give about protecting, that we talk about every week here, about protecting you against serious illness and hospitalization and death, those stats are based on 2 doses. Those are based on people who've had 2 shots. And so we still believe that those numbers are correct and they still apply. So, we want people to get boosters as soon as they're eligible, but I don't think that's as important as getting unvaccinated people their first shot, or particularly their first and second shot. That's still the most important thing.
Thank you.
Hey, Dr. Scott Harris, can you hear me?
Yes.
Hey, this is Lisa with NBC 15 here in Mobile. My question is about Pfizer is asking the FDA to authorize emergency use of the COVID vaccine for children 5 to 11. I know you touched on that earlier. But you also said that, the Pfizer vaccine is available for children 12 and up, but kids are still, have the lowest vaccination rate right now, and they are sources of infection. So my question is, I just want you to weigh in on this if you can. So what about parents who are already reluctant to get the vaccine themselves? Will that same hesitancy make them reluctant to get their children vaccinated? Because we do know that a lot of parents of small children are between the ages of 25 and 39 in that age range. And so I'm just curious if you can possibly weigh in on that.
Sure. I think that's really a concern, other than those adolescents and teenagers, who are our least vaccinated group. The next least vaccinated group is the age group that contains the parents of those people. And so I don't think that's I don't think that's a coincidence. I think children are probably vaccinated sort of in keeping with whether or not their parents are vaccinated or not. And so given that young adults have been, very hesitant about getting the vaccine, I don't think it's surprising that kids haven't been vaccinated more highly than they have. I think if I can, let me turn to Dr. Karen Landers. She's our pediatrician and is on the call, and she may want to weigh in on that. Karen, are you there?
Thank you.
Dr. Harris, thank you for allowing me to comment. I think when we speak to the issue of vaccinating children, we have to remember that COVID will find a place for people, and the place is people that are not vaccinated. And certainly COVID has found a place in our pediatric population, because during this most recent surge, 20% or above, we were even up to 25% cases in the population of 0 to 17. So it's absolutely critical for persons to continue to educate themselves regarding the vaccine, listen to their physicians, listen to vetted information. And as this comes out for pediatrics, and again, both Dr. Stubblefield and I are following this extremely closely because we are both pediatricians, keep in mind that we are looking at study data, we're looking at scientific data, the data for vaccinating persons in the 5 to 11 age group. Of course, that will also include a smaller dose of the Pfizer vaccine if it is approved. So again, continuing to educate and remind persons this vaccine is safe, this vaccine is effective. We have data for millions and millions of people having been vaccinated without a significant side effects profile, again, whether it's in the younger population or the older population. Our hospitals were not full of people with vaccine side effects. So as a pediatrician myself, and joining the Alabama chapter of the American Academy of Pediatrics, as well as the American Academy of Pediatrics, which represents well over 60,000 pediatricians, we want to keep these children safe, not only from this disease, but also from the potential complications of long COVID as well as MIS-C. Thank you.
Thank you, Dr. Landers.
Thank you. And that brings me just really quick to my next question. So Dr. Scott Harris, you mentioned how, kids are sources of infections, they're kids. So how would, if this was approved, children 5 to 11, and then of course if we started seeing more children getting vaccinated from 12 and up with the Pfizer vaccine, since it's already approved, how would this help the current conditions that we're in regards to the pandemic?
If we're ever going to really see this disease, subside to levels that are, more manageable than we're seeing now, we're going to have a significant number of young people vaccinated. I mean, in our state, that's out of our 5 million or so people, you're talking about 1 million people or so. And so, we're going to need a lot of those young people to be vaccinated in order to really break this transmission cycle. I do think we're going to, live with COVID from now on. It seems very likely that it's never going to vanish. We're going to have to deal with it. But of course, our priority is to protect those people who are most at risk for serious illness and death, and to protect our healthcare system so that they're not overwhelmed. But we also want to protect kids as well. A disease that takes kids out of school and makes them sit at home for a couple of weeks, even if, perhaps they're not all that sick in a lot of cases, is still a really bad situation that we want to try to prevent if we can do that. So we're going to need to get kids vaccinated, and as soon as we have this information available and have a chance to look at it and see what the federal guidance is on that, then we'll certainly be letting everyone know about that.
Thank you.
Okay. Any other questions?
Dr. Harris, to follow up on that question, the 5 to 11 for Pfizer that's under consideration, it's I think a third dose or third as strong as those 12 to 17 and over. But yet, I guess just talk about that. The needs the difference, but yet at the same time, it will provide equal protection or at least good enough protection.
Yeah, that was a dose chosen for the studies that they've been doing, and so that's what they've based their EUA application on. The pediatric dose, for age 11 and below, is about a third the dose of the standard dose, which is given to everybody else. And so, that's just how they designed it based on their, scientific predictions of what would be effective, and it seems that dose is effective. So I haven't seen the actual numbers to compare them in terms of is one slightly more effective than the other, but from what we have heard from press reports and what we've heard from discussions with our federal partners, it's very highly effective in that group at that dose. Okay, any other questions? All right. Well, thank you all very much for joining us. We appreciate it. Bye. Thank you, guys.
It'll probably, it's a little bit.
Will it be eventually become